In the United States, a major resurgence of measles is occurring. Since January, the outbreak has expanded rapidly, centered largely in Texas. As of early April, over 480 confirmed cases have been reported in Texas alone, including dozens of hospitalizations and the tragic loss of a child who was unvaccinated. The virus has also crossed state lines, spreading into neighboring areas including New Mexico, Oklahoma, and Kansas. Nationwide, over 600 cases have already been logged, exceeding the entire count of last year. This acceleration is being driven by declining childhood vaccination rates, growing vaccine hesitancy, and a patchwork of exemption laws. Health authorities have activated response teams, and messaging around the importance of the MMR vaccine is being amplified across state and local networks. Meanwhile, in North America, the first human case of H5N1 avian influenza has been identified in Mexico. A young child remains in serious condition, and health officials are investigating the source of infection. Though there is no current evidence of human-to-human transmission, this case signals a continued need for vigilance, especially in regions with ongoing poultry outbreaks. Public health agencies are emphasizing the importance of avoiding contact with sick or dead birds and following all biosecurity protocols in agricultural zones. In the Pacific Islands, Fiji is reporting an alarming spike in dengue fever cases. For 2 consecutive weeks, the nation has recorded over 800 new infections per week, well above historical trends. This surge is placing strain on local hospitals and health resources. Authorities are urging residents and visitors alike to use insect repellent, eliminate standing water, and seek immediate care for fever, muscle pain, or rash, which are common early symptoms. The seasonal uptick is linked to rising temperatures and increased rainfall, both known to accelerate mosquito breeding cycles. South America is also facing its own viral resurgence. Countries including Brazil, Argentina, and Bolivia have recorded significant increases in Zika virus infections. Brazil alone has reported more than 5,500 cases so far this year. Argentina and Bolivia are seeing smaller, but still concerning numbers. Zika virus, primarily spread through Aedes mosquitoes, has been linked to severe birth defects in newborns. As a result, many health authorities are urging pregnant women to avoid travel to affected areas and intensifying public health campaigns focused on prevention and vector control. In Europe, Hungary and Slovakia are now addressing outbreaks of foot and mouth disease, an illness that primarily affects cloven-hoofed animals such as cows, pigs, and sheep. Hungary's detection of the virus marks the first confirmed case there in 5 decades. To control the outbreak, strict biosecurity measures, quarantines, and culling of infected livestock are underway. While the disease does not typically spread to humans, its economic impact on agriculture can be significant, and public health officials are coordinating closely with veterinary services. Taken together, these reports offer a powerful reminder of the interconnected nature of global health. Whether it's a preventable childhood illness like measles, a vector-borne tropical virus like dengue or Zika, or a zoonotic virus with pandemic potential like H5N1, each of these threats underscores the critical role of science-based health policies, international cooperation, and timely public health response. One of the most important tools remains consistent and widespread vaccination. Measles, in particular, is one of the most contagious viruses known to science. A single infected person can expose dozens of others, especially in unvaccinated communities. Immunization efforts, long heralded as one of the greatest achievements of modern medicine, are at risk when misinformation and hesitancy go unchecked. Addressing this challenge requires compassion, communication, and data-driven education. Similarly, diseases transmitted by mosquitoes, like dengue, Zika, and chikungunya, are heavily influenced by climate patterns. As global temperatures rise, the geographic reach of these diseases expands. Urbanization, travel, and changing rainfall trends all contribute to shifts in vector habitats. Public health strategies need to adapt not only reactively but also proactively, planning for these seasonal and long-term changes. Zoonotic viruses, those transmitted from animals to humans, remain one of the most unpredictable elements in global health. H5N1, along with other avian influenza strains, continues to circulate among birds, especially in dense poultry operations. Occasional spillover into humans raises the stakes. Continued monitoring, rapid genetic sequencing, and international reporting are essential. Laboratory surveillance allows scientists to detect mutations that might enable human-to-human spread. And while no such development has been confirmed in recent cases, preparedness is the key to prevention. Outbreaks like foot and mouth disease might seem distant to those not involved in agriculture, but they too are part of this mosaic. They highlight how animal health and human health are tightly linked, concepts captured in the One Health approach, which unites human medicine, veterinary science, and environmental awareness. From rural farmlands to crowded cities, viruses don't recognize borders. The response to them must therefore be global, coordinated, and timely. The stories we've shared today reflect just a fraction of the daily work being done by scientists, clinicians, public health workers, and communities all over the world. Their vigilance helps safeguard our collective well-being. As we reflect on this moment in global health, let us also consider our role as informed citizens. Staying up to date with factual, science-based information is more than a personal responsibility. It's a form of public service. From handwashing and mosquito control to routine immunizations and trust in medical science, our choices ripple outward. Stay safe, stay informed, and until next time, take care.